Yeah, look, it's a fine line between distraction and avoidance.
Yeah.
Sometimes, where people are feeling blue, we encourage them to keep doing the things that they know make them happy when they're not feeling blue. So if someone regularly goes to the gym or, regularly attends a knitting group or
To keep up with the routine.
yeah, just keep doing the things that they know, because the depression clouds it. The depression says don't do any of that.
Just
and as
sleep.
a result of not doing those things, they go deeper and deeper into depression. So that's the idea of behavioral activation. Some people might be severely depressed and, find it hard to get out of bed and shower.
Yeah. Oh, any movement, even, just to
Yeah.
move. It's frightening to...
And so we talk to them about, a bit of a leap of faith or putting the cart before the horse. From a behavioural perspective, you have to start doing these things, even though it's the complete opposite to what you feel like doing. And that's the way that you start to turn the ship of depression, at least one aspect of it.
Yeah.
Distraction and avoidance is something that, I spend a lot of time thinking about and talking to clients about. And the way that I kind of explain it to people is, if they're really distressed, and it can be anxious or depressed, if they can't really affect the outcome, then a distraction technique is probably good.
What do you mean by not affect the outcome? So when they don't actualize...
Oh, good question. So probably easy to explain in, I'll say, give an example for anxiety first, and then we'll talk about depression. But, you've had a blood test from a doctor and they say you're going to get the results in a week. Nothing you can do.
Yeah.
You just got to sit with that anxiety,
Right, yeah.
give up smoking for a week, or
Yeah.
get a gym membership, or become a vegan. It's not really going to change anything, right?
Because you're already taken the test.
Yeah.
Yeah.
And so you just got to sit with it.
Yeah.
Compare that to, getting a letter, saying your power is going to be cut off tomorrow, or in a week. You can influence that outcome. You can ring up the next day. You can come up with a payment plan.
I see, yeah.
You can problem solve your way through that. You can work your way through it. I guess similar examples could be with relationships. Do you just stew over something? Do you think, I'd really like to say this to someone, apologize or vent or whatever it is, but not do it for a week? Or do you sort of spend a day, plan it out, and do it the next day? So where you can't influence the outcome, where you are forced to sit with the anxiety, the distress, the butterflies, the churning stomach, just feeling on edge, trouble sleeping, all those sorts of things, then distraction's good. And look, if you're going to pick an activity to distract yourself with, giving to others, it's top of the list, right? Some people look to distract themselves with drugs and alcohol. That's different to going and trying to, bring about some pleasure or joy in someone else's life. The difference and the distinction I think that's important to make, though, is that sometimes distraction can serve the purpose of someone actually working on problems. And avoidance. Avoidance is a big word in psychology. It's where you've got something that you need to deal with.
Yeah.
Either, an external issue or a thought or some anxiety within you. But you choose to do something else rather than, sit down and work it out or think through it. And, not everyone has the ability to be able to sit down and work it all out. And, that's where therapy comes into play. That's of course okay. But yeah, it is really important to distinguish between the two. And again, it's not always really clear cut. Not always really clear cut. But we do need to be aware of the difference. Yeah, distraction or avoidance.
Avoidant. Mm.
Probably a good example. A lot of people in Adelaide could probably relate to this. But, my work I do, I see a lot of people who've been in cycling accidents
Yeah.
in the brain injury field.
I know somebody personally. Yeah.
Do you? Yeah. It's some fairly horrific stuff.
Mm.
And, some of these people, they ride 100 Ks a day.
Yeah.
I don't know if I call it an addiction or whatever, but similar to being a workaholic, I guess, they cycle and they cycle and they cycle. And it can be a fairly good stress management tool, I guess, by and large. Where you start to work out that it's perhaps has been a bit of a distraction, a bit of an unhelpful, perhaps long-term way of avoiding emotions is when, they've been in an accident and they can't ride for a while.
Yeah.
And they really start to struggle. They've got an injured leg or their arm's in a sling or their vision's been affected or they can't ride, they're dizzy. It's just not safe for them to ride. And where they don't have that ability to either, manage stress or avoid their distressing emotions, they really start to struggle. And they need new strategies.
Like a new activity.
Yeah, or they need to speak to someone like me and actually work through some of the emotions that they've been avoiding all that time that's maybe led to them cycling 100 kilometres a day. And we're not going to pick on the cyclists here.
No.
There's workaholics, there's marathon runners, there's
musicians,
alcoholics, shopaholics, sexaholics, you name it. Plenty of things you can distract yourself with. Does that make sense? The idea of distraction and avoidance?
Yeah, that does. Very clear, and the example you've made before was very... Yeah.
How would that factor into depression though, I guess, which is kind of a little bit that you're alluding to, and I guess something that I would explain to people to help with that is the idea of anxiety generally being a forward-focused thing, worry about the future.
Yeah.
Whereas depression is generally based in the past.
Yeah.
It's based in rumination about things that have transpired already. Guilt, regret, shame.
Yeah.
And, of course, we can't change what's happened in the future. I mean, in the past. Yeah, we can't change it.
And the future is essentially now.
The future can be influenced now, but for some people,